1169 is approved. Can you please read the title for time certain resolution, item number 1355?
Urge Congress to enact the United States National Health Care Act, sponsored by Representative John Conyers.
Commissioner Leonard.
Thank you, Mayor Adams, colleagues, and it's great to see the folks out here that are in support of our action today, but particularly my friend Tom Lee, who has led this effort. Tom is one of my heroes in the labor movement and has been one of the most active Teamsters in the United States, including running for president three times and he'll make it someday. And if not there, he belongs on the national stage. He is a true progressive labor leader, and I'm proud to count him as a friend. America's health system faces a deepening crisis. The crisis has three dimensions. First, the lack of universality. Second, the excessive costs rising much faster than general inflation. And finally, poor health outcomes compared to other developed nations. The U.S. spends 16% of its annual gross domestic product on healthcare delivery and administration, more than twice the average of the highly developed Organization for Economic Cooperation and Development nations. That translates to $7,290 per person and 2.5 times the developed nation's average. Yet, unlike those countries, the U.S. fails to provide universal health care. And the U.S. gets worse health outcomes despite the highest level of spending. A national tax-funded social insurance system, like that proposed in House Resolution 676, is the only kind of health care reform that can address all three dimensions of the current health care crisis. First, let's talk about the lack of universal health care. According to the Congressional Budget Office, 50 million people in the United States lack health insurance. That is nearly one person in 6. 50 million people also is 1 in 4 of those not covered under Medicare, Medicaid, the Veterans Administration health system, or the military health system. In other words, 25% of the civilians who are not extremely poor and who are working age or are children lack health insurance in the United States. All other developed countries cover everyone at the lowest cost than does the U.S., at a much lower cost than the U.S. Let's talk about costs. The United States pays the highest proportion of our gross domestic product and the highest cost per person of any country in the world for administration and delivery of health care. Yet we fail to include everyone, and we get worse results. Private health insurance premiums are increasing at least twice as fast as the rate of inflation, making health insurance less and less affordable every year. If the present rates of growth continue, the average cost of health insurance will equal 100% of the average income of American workers by 2025. Every cent of your check would have to go to health insurance if the rate of increases continues until 2025. In the private insurance sector, including private plans contracted for public employees like governments, between 20 and 30% of the costs do not deliver health care. Those costs go to inefficient private bureaucracies and profits of insurance companies. By contrast, administrative overhead in Medicare, Medicaid, and the Veterans Administration are from 4 to 8%. Of all United States bankruptcies, 62% of them are due to medical expenses, and of all medical bankruptcies, more than 75% happen to people who already have health insurance. The proportion of medically related bankruptcies is rising because of rising deductibles and co-pays and lowered maximum benefits used to keep premiums from rising even faster than what they are, but you still pay for it out of your pocket. In 2007, nearly 2/3 of U.S. adults, or an estimated 116 million people, struggled to pay medical bills in the United States. They went without needed care because of cost, were uninsured for a time, or were underinsured, meaning they were insured but not adequately protected from high medical expenses. In the survey of persons who were chronically ill in 6 developed countries, 51% of the Americans skipped needed care or drugs because of the cost. Australia was the next highest, with 36%. In the Netherlands, the proportion was 3%, and in the United Kingdom, 13%. We were 51%. Poor health outcomes and the quality of care issues is another subject. The United States ranked 37th in the last global survey of the overall effectiveness of the national health systems conducted by the World Health Organization. In the same survey, the United States ranked 72nd in a measure of cost efficiency, in other words, of the quality of the outcome for the amount of money spent, 72nd in the world. Here's what Representative John Conyers' resolution, House Resolution 676, would do. Entitled the Expanded and Improved Medicare for All Act. As under the current Medicare system, doctors would remain private and their bills will be paid for out of tax dollars. Unlike Medicare, there would be no additional premiums. With this single payer system, people could see any doctor they wanted for any care they needed with no copays, no deductible, and no lifetime caps. If a person changed jobs, or were laid off, or became too sick to work, he or she would keep the same health care. A benefit that there are a number of people in this audience right now feel the impact of not having it. House Resolution 676 would solve the universality problem by making everyone living in the United States eligible for Medicare. It would solve the immediate cost problem of including all the uninsured and ending underinsurance and vulnerability for those with insurance by realizing savings from cutting the hugely wasteful private insurance bureaucracy and profits. Premiums and out-of-pocket expenses would be replaced by taxes at a fixed, known rate. Health benefits would be converted to wages and salaries, ending costs rising faster than incomes for workers or wage costs for employers. Over time, the bill would shift emphasis in care to health promotion, prevention, primary care, and early stage protection and disease management, thereby reducing costs. Likewise, compensation systems for providers would be reformed to be based on health-effective results, not on the number or cost of services ordered. Existing Medicare would be stabilized by taking a high-risk, high-cost pool of elders and folding them into a population-wide universal risk, spreading everyone's costs and risk across the entire population, young and old, healthy or not. This is the last frontier in the fight for rights for all in this country. The right to be given the same medical care whether you are young or old, poor or rich, man or woman, healthy or not, is a right that is inherent in our existence. In the name of all that's right, and on behalf of those too weak and powerless to speak for themselves here today, I urge this council to support this urgent message of support to Congress in support of H.R. 76 and our universally respected President, Barack Obama. Thank you.
Nice.